Hey there, folks. Welcome back to ShockDoc Medical. I'm Dr. Raad, and today we're diving deep into one of the most fascinating and crucial topics in dermatology, the history of skin tumors, and how we can better spot, understand, and ultimately help patients with skin cancer. Now, have you ever wondered how the simple story behind a skin lesion can be a window into something as serious as cancer? Well, stick around because we're about to break it all down. All right, let's set the stage. We all know that skin cancer is the most common type of cancer out there. And guess what? The non-melanocytic types, basal cell carcinoma, BCC, which happens to be the most common, and squamous cell carcinoma, SCC, are even more prevalent than malignant melanoma. But here's the kicker. All these cancers are on the rise. Now, if you're like most elderly Caucasian patients, you've probably seen your fair share of sun-damaged skin. That sun damage? It's a big red flag for the risk of developing skin cancer. When a patient walks in with a cutaneous tumor, or even just a solitary scaly lesion, the first thing you gotta do is dive into their history. And no, I'm not just talking about asking, how are you today? I'm talking about really digging in. Here's what you need to find out. Duration. How long has that lesion been hanging around? Change. Is it evolving? Remember, many skin cancers grow so slowly that patients might not even notice any recent change. Triggers. Has anything happened to cause the change, like trauma or some kind of bump that got banged up? Symptoms. Is it itching, tickling, or even causing pain? Sometimes, non-melanocytic skin cancers can be a bit symptomatic. Think of an SCC that might even be tender or painful. Pre-existing marks. Was there already a brown spot or mole there? Fun fact, most malignant melanomas actually pop up out of nowhere rather than developing from a pre-existing melanocytic lesion. Now, if you're a doctor or even just a curious listener, these questions might seem basic, but trust me, they're gold. They guide us to decide if the patient is likely dealing with skin cancer. And folks, the devil's in the details. Let's talk risk factors next. This is where things get really interesting. When documenting a patient's risk, you need to consider several key aspects. Skin phototype. What happens to their skin in the sun? Are we talking about a quick burn or a slow tan? History of sunburn, especially those nasty burns from childhood that leave a lasting mark. Chronic sun exposure. Ask about their job, hobbies, or even holiday trips. Did they work outdoors, serve in the military, or spend long sunny vacations in hot climates? And importantly, how did they protect their skin? Previous skin cancers. Any history of skin cancer in the past is a major flag. Chronic immunosuppression or photosensitivity. This could be from drugs or other causes that make the skin more sensitive to light. Exposure to carcinogens. Now, this might sound wild, but exposure to industrial tars or oils, or even pipe smoking, especially those clay pipes still used in parts of India that have been linked to SCC of the lower lip, can increase risk. And don't forget about X-irradiation or even arsenic exposure. Arsenic was once found in old-fashioned tonics like Fowler's solution and can still be a contaminant in well water in places like Bangladesh, parts of India, and Taiwan. Family history of skin cancers. Always a key piece of the puzzle. Now let's break down that all-important skin phototype. This is where the Fitzpatrick classification comes into play. And trust me, it's a game changer when it comes to understanding a patient's risk. Let me run you through it. Type 1. This skin always burns and never tans. Think white or pale skin with lots of freckles, blonde or red hair, blue or green eyes. Type 2. Burns easily and tans poorly. Similar to Type 1, often with pale skin and maybe some freckles, and typically blonde hair with blue eyes. Type 3. Sometimes burns and tans lightly. This usually means darker white skin, dark hair, and brown eyes. Type 4 burns minimally and tans easily. This is the olive skin type, often with brown or black hair and brown eyes, very common in Mediterranean populations. Type 5 rarely burns and always tans. These folks usually have naturally black-brown skin, dark brown eyes and hair, common among Asians, Latin Americans, and people from the Middle East. Type 6 never burns and tans darkly. This is naturally black-brown skin, typically with matching dark brown eyes and hair, most common among Black Africans. Why is all this important? Because understanding these details isn't just academic. It directly impacts how we assess risk and decide on further management. A thorough history isn't just about getting the facts. It's about piecing together a story that could reveal early signs of something as serious as skin cancer. And for our fellow doctors out there, it's a reminder to be meticulous when evaluating any cutaneous lesion or isolated scaly patch. Now, I want to stress something important. This isn't just for healthcare professionals. Even if you're just tuning in out of curiosity, understanding these risk factors can empower you to have informed conversations with your doctor. If you notice any changes in your skin, think back to these points. How long has that lesion been there? Is it changing? Could there have been trauma? And what about your sun exposure history? At ShockDoc Medical, our mission is to break down complex medical topics into clear, actionable insights that can genuinely help both patients and providers. Whether you're a practicing clinician or someone who just wants to be more health savvy, knowing the history behind skin tumors and the risk factors that go with them can make a huge difference in early detection and treatment outcomes. Now, here's a question for you. Have you ever had a skin lesion that made you think twice about your sun habits? Or are you a doctor who's seen how these subtle signs can lead to a major diagnosis? I'd love to hear your stories and questions. Drop them in the comments or reach out on our social media channels. Let's build this community of curious minds together. All right, as we wrap up today's deep dive into the history in dermatology, let's recap. Skin cancers, including basal cell carcinoma and squamous cell carcinoma, are on the rise. A meticulous patient history can reveal key details about lesion duration, changes, and symptoms. We need to document risk factors like sunburn history, chronic sun exposure, previous skin cancers, immunosuppression, exposure to carcinogens, and family history. And finally, understanding skin phototype via the Fitzpatrick classification is crucial in assessing risk. Thank you for joining me on this journey into the fascinating world of dermatology. If you found today's episode helpful, please hit that like button, subscribe, and share this podcast with friends, colleagues, and anyone who might benefit from these insights. And hey, let's keep the conversation going. Tell me your thoughts, questions, and personal experiences in the comments below. Next week, we'll be exploring another groundbreaking discovery that could reshape how we approach medicine. Trust me, you won't want to miss it. Until then, this is Dr. Raad signing off from ShockDoc Medical. Stay curious, stay informed, and take care of your skin, folks.